Today we're going to be doing trauma assessment skill sheet. I swear it has been funny trying to get this video recorded. All right, let's get into it.
All right, you're dispatched to the scene of a male. Caller says it was an assault.
All right, BSI scene safe.
Your scene is safe.
My mechanism of injury is an assault. I'm going to get police and an additional EMS unit on the way. How many patients do I have?
Just one.
All right, so I'm going to have my partner grab C-spot in a neutral inline position. My general impression is a 30-something-year-old male lying supine with his eyes closed. Sir, are you okay?
He does not respond.
Okay, so my patient is unresponsive. Do I have any life threats?
You do notice bright red blood coming from his left thigh.
Okay, so I'm going to put direct pressure.
Okay, it continues to bleed.
Okay, so I'm going to put a tourniquet high and tight on his left leg. I'm going to keep turning the windlass until bleeding stops and his pulse disappears. If need be, I will add an additional tourniquet for additional control.
Okay, bleeding is now controlled with the tourniquet.
Okay, all right. So now I am going to check my patient's airway. I am going to do a jaw thrust maneuver.
Okay, airway is clear.
Airway is clear. Okay, so I am going to add an adjunct because he cannot hold his own airway. I'm going to measure from the corner of the ear to the corner of the mouth. I'm going to do a 180. And does he accept the adjunct?
Yes.
Okay, so I'm going down to breathing. How is his rate and quality?
His rate is 8 respirations a minute in shallow.
Okay, so I am going to have my partner start bagging him at 15 liters per minute, 1 breath every 6 seconds. Each breath will be over 1 second. Does he have equal chest rise and fall?
Yes.
Okay. What about lung sounds?
Lung sounds are diminished bilaterally.
Okay. All right. So, circulation, how is his heart rate and quality?
His heart rate is 140 and 30.
Okay. Is there any other bleeding?
No.
How is his skin?
Skin is cool, pale, and diaphoretic.
All right. So that's signs of shock. So I will make sure I keep my patient warm, elevate his feet, and then we already bagging him with high flow oxygen. So my patient is a load and go. So I want to be off scene in less than 10 minutes. Is there anybody around to get a sample history from?
No.
Okay. And my patient's unresponsive, so I can't get that. So what are his vitals? I like the blood pressure, heart rate, respirations, SpO2, and also his blood glucose.
Okay. His blood pressure is 80/60. Heart rate is 140. With him being bagged, it is about 16 a minute. Okay. 88% with room air, but on the oxygen, he's 100%. Okay. And his blood glucose is 100.
Okay. All right. So I am going to go into my secondary assessment. DCAP BTLS, standing for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. So I'm going to start at his head doing DCAP BTLS.
There are nothing noted.
I'm going to check his eyes.
Nothing noted.
Check his nose.
Nothing noted.
I'm going to go down and check his ears.
Nothing noted.
I'm going to check his mouth again.
No abnormalities.
Okay, so I'm going to go down to his neck. I'm going to DCAP BTLS his neck. I'm going to start in the back and look for step-offs.
No abnormalities.
I'm going to check for JVD.
Unremarkable.
I'm going to check for trachea deviation.
And unremarkable.
Okay, so I'm going to expose his body. I'm going to check his sternum, make sure that's intact. I'm going to DCAP BTLS his chest. Do I find anything on his chest?
You notice that there are 2 GSWs to his left chest.
Okay, so I am going to put occlusive dressings over those or chest seals if I have them. And I'm going to continue down to his abdomen. I'm going to DCAP BTLS.
You notice another GSW in his right lower quadrant of the abdomen.
Okay, so I am going to put a thick dressing on that and just put bandage it up.
Okay.
All right. I'm going to go down to his pelvis. I'm going to decap BTLS. I'm going to open and close the book.
Okay, pelvis is stable.
All right, I'm going to check the genital area.
Unremarkable.
Okay, so I know I have the tourniquet on this leg, so I'm going to still check around the decap BTLS, the rest of the leg.
No abnormalities.
All right, so I'm going to check. I can't check this pulse. I can't check motor and sensory on this foot, but I can check the pulse on this one because I would take off his shoes.
Okay. The patient is not responsive, but
Okay.
we do feel a pulse on the right foot.
Okay, awesome. So I'm going to slide around here. I'm going to decap BTLS this leg.
Unremarkable.
Okay. I'm going to decap BTLS his arm.
Unremarkable.
Okay. I am going to compare both pulses.
Pulses are equal and Freddie.
Okay. So I can't get a motor and sensory because he's unresponsive. I'm going to check decap BTLS down this arm.
Unremarkable.
All right. Since he has an injury on the left leg, I am going to log roll on heads count. 1, 2, 3. I'm going to decap BTLS down his back.
You do notice that there are 2 exit wounds on his lower back.
Okay, so I am going to put chest seals or occlusive dressing over those. Anything over his buttocks, decap BTLS.
Unremarkable.
Back of his legs.
Unremarkable.
I will put him on whatever moving device I will use. Lay him back on heads count, nipple, navel, knees, head last. I will continue to do reassessment every 5 minutes and manage secondary wounds.
Okay, is there anything I should do for this patient?
No.
All right, you have completed it in 7 minutes and 10 seconds, and the required time was 10 minutes.